Hi, my name is Marlene Gomezdiaz. I will be presenting my clinical presentation today. Here we have a patient history. A 45-year-old Caucasian male presents with abdominal swelling, facial and leg puffiness, easy bruising. He appears to be 6 feet and 2 inches tall, 220 pounds. The blood pressure is 135 over 75. The hematocrit is 50%. His career in show business appears is very important to him. Experiencing stress due to a custody battle with ex-wife. The patient also has symptoms along with his demographic information and stress factors suggest a liver disorder. Liver dysfunction can manifest in various ways, including abdominal swelling, bruising, and fluid retention. The glucose test done with a blood sample is important for checking glucose levels in the blood. High levels could mean diabetes or liver issues, while low levels could indicate hypoglycemia. This test usually uses enzymes to break down glucose, creating gluconic acid and hydrogen peroxide. When hydrogen peroxide reacts with a certain substance, it creates a color product. The intensity of this color shows how much glucose is present. The test helps diagnose metabolic disorders and decide on treatment. Specifically, looking at the data for CK enzyme, the absorbance increases steadily from 20 at the start to 750 at the end of the assay. For LD enzyme, the absorbance rises more rapidly, starting at 90, reaching 4,710 by the end of the assay. High levels of CK and LD indicate tissue damage, supporting our belief that the patient has liver issues. Studying the enzyme kinetics gives us specific details about the damage, which helps us diagnose and treat the patient better. In short, analyzing enzyme kinetics is vital for evaluating tissue damage and deciding on treatment. The CK and LD test results helps us understand the patient's condition and plan treatment accordingly. Urinalysis gives us important details about kidney function, hydration, and possible metabolic issues. When our test shows abnormal protein levels in the urine, it suggests there might be a kidney problem. This could indicate damage to the kidney's filtering system or other kidney diseases. So, more tests might be needed to check. It's important to thoroughly assess and monitor kidney function, especially considering the patient's symptoms and the urinalysis results. Further testing, like renal function tests and imaging studies, might be necessary to understand the full picture. To sum up, while enzyme kinetics data help measure tissue damage, urinalysis provides critical information about kidney health and metabolic issues. Together, these tests guide treatment decisions for the patient. When comparing glucose determination and urinalysis, we see they give us different but complementary information about both metabolism and kidney function. Glucose determination focuses on blood sugar levels, while urinalysis looks at how well the kidney are working and if there are any unusual substances in the urine, like proteins. Finding abnormal protein levels in the urine suggests kidney issues, supporting our suspicion that multiple organs might be affected. This strengthens our belief that liver problems could be causing complications in the kidneys. Looking at the relationship between glucose determination and enzyme kinetics Assays. We notice that they give us insights into different aspects of metabolism and tissue health, even though they're not directly related. Even if the patient's blood sugar levels are normal, liver issues can show up in other ways besides affecting glucose levels. Plus, seeing high levels of lactate, dehydrogenase ACE, LD, and enzyme kinetics. Assays suggest ongoing tissue damage which could be linked to liver problems, adding more information to our diagnosis. When comparing glucose determination with enzyme kinetics assays, we see they provide insights into different aspects of metabolism and tissue health. Although they're indirectly connected, even if the patient's blood sugar level are normal, liver issues can manifest in ways other than affecting glucose levels. Looking closer, while creatine kinase levels are normal, the higher levels of lactate indicate ongoing tissue damage, which might be linked to liver problems. So, despite normal glucose levels, the abnormal levels gives us more information supporting the idea that the liver could be involved in the patient's condition. Glucose determination measures blood sugar levels, while urinalysis examines different aspects of urine composition. The urinalysis shows normal pH and specific gravity, indicating no major issues with urine acidity or concentration. However, it does detect abnormal protein levels, suggesting possible kidney problems. This supports our idea that multiple organs may be affected, with the presence of abnormal protein possibly indicating kidney issues due to liver problems. Even though the glucose test suggests normal blood sugar levels, the abnormal protein in the urine adds weight to our suspicion of underlying kidney problems. Together, the information from both tests helps us better understand the patient's metabolic and kidney health, guiding our diagnosis and treatment planning. After reviewing the test results and considering the patient's clinical presentation, hepatic cirrhosis stands out as the most probable diagnosis, while worth entertain alternative possibilities such as other liver conditions or kidney diseases. The patient's profile and the outcomes of the tests lead us to believe that hepatic cirrhosis is the primary concern. Hepatic cirrhosis is a chronic liver disease characterized by the gradual replacement of healthy liver tissue and scar tissue, leading to impaired liver function over the time. The test results, including abnormal liver enzyme levels, imaging findings consistent with liver damage, and clinical symptoms such as jaundice and abnormal swelling, align closely with the typical manifestations of cirrhosis. Furthermore, the patient's medical history and risk factors, such as alcohol abuse or viral hepatitis infection, also supports this diagnosis. The treatment plan focuses on managing liver issues through lifestyle changes, diet adjustments, medication, and regular checkups. This includes adopting a liver friendly diet, staying active, managing stress, and taking prescribed medications. The aim is to ease symptoms, improve liver health, and slow down the progression of the disease. With successful treatment, we can expect to see better test results, reduce inflammation, and overall improve health.